Every 66 seconds, another older adult in America hears the words, "You have dementia." Before you finish watching this video, nearly 20 more families will receive that same life-changing diagnosis. But here's what many people never discover. For a surprising number of those individuals, the real cause wasn't simply growing older. It was a medication they had been taking for months or even years. A medication sitting in their bathroom cabinet. One they trusted because it was prescribed by a doctor or sold over the counter without a prescription. I'm Dr. William. After more than 15 years of caring for older adults, I've watched this heartbreaking story unfold again and again. A person who has always been mentally sharp suddenly starts forgetting names, missing appointments, repeating conversations, or getting lost on roads they've driven for decades. Their family assumes it's normal aging. Friends say it's just part of getting older. But in many cases, it isn't. Sometimes the real culprit is hiding in plain sight, a medication almost nobody thinks to question because it came from a trusted healthcare provider. And that's exactly what newer scientific research continues to reveal. Several commonly used medications have been linked to significant declines in memory, concentration, and learning ability. Some studies suggest these changes can begin within a single year of regular use. Even more concerning, most people taking these medications have absolutely no idea they're affecting their brain. In today's video, I'll walk you through the 9 medications most strongly associated with memory decline, beginning with the ones people rarely suspect and ending with the medication combination I consider the greatest hidden threat to an aging brain. Make sure you stay until number 3. Millions of seniors take it every single day for a condition that seems completely harmless, yet it may be silently affecting the brain's memory center without producing any obvious warning signs. Before we begin, I'd like to hear from you. Tell me your age in the comments and let me know which medications you take every day. I personally read your comments, and your feedback helps shape future videos on this channel. Now, let's begin our countdown. Medication number 9, diphenhydramine, Benadryl. Don't let its position at number 9 fool you. This medication is one of the most common drugs found in medicine cabinets across the country. Medication number 9 is diphenhydramine, better known by its brand name Benadryl. It's the familiar pink tablet millions of people take for allergies, trouble sleeping, or cold symptoms. Because it's inexpensive and available without a prescription, many assume it's completely harmless. Unfortunately, your brain tells a different story. Benadryl belongs to a category of medications known as anticholinergics. While the name sounds technical, the concept is actually very simple. These medications block a vital brain chemical called acetylcholine. Acetylcholine is responsible for helping your brain create new memories, stay focused, and process information efficiently throughout the day. As we grow older, our brains naturally produce less acetylcholine. That means every remaining amount becomes increasingly important. When a medication blocks this chemical in a younger adult, the effects may be relatively small. But in someone over the age of 65 or 70, the impact can be much greater. One of the brain regions affected the most is the hippocampus, the area responsible for forming and organizing new memories before they're stored for long-term recall. Throughout my years in practice, I've met many older patients who relied on a nighttime antihistamine for years. Slowly, they began experiencing mental fog. They forgot appointments, misplaced everyday items, repeated stories, lost track of conversations. Not once did they suspect the little pink pill sitting on the nightstand. Instead, they blamed aging. The science tells a different story. A 2023 study published in the Journal of Geriatric Cognitive Health found that older adults who regularly used anticholinergic medications had a 54% higher risk of developing dementia than those who avoided them. Think about that for a moment. More than half again the normal risk from a medication many people use without giving it a second thought. Here's what I recommend. Take a careful look at every medication you use for sleep. Check anything labeled PM, nighttime, or allergy relief. Many of these products contain diphenhydramine under different brand names. If allergies are your primary concern, speak with your physician about newer antihistamines such as loratadine, Claritin, or cetirizine, Zyrtec, which generally have much less effect on the brain and are considered safer for long-term use in older adults. Never stop taking a medication without first speaking with your healthcare provider. But also don't assume that because a medication is sold over the counter, it's automatically safe for your memory. That assumption has led far too many people down a difficult road. Medication number 8, proton pump inhibitors, PPIs. The next medication on our list is one that helps millions of people every day. Ironically, while it brings relief to the stomach, it may quietly create problems for the brain. Medication number 8 is a group of drugs known as proton pump inhibitors, often called PPIs. Common examples include omeprazole, Prilosec, and esomeprazole, Nexium. These medications reduce the amount of acid produced in the stomach and are commonly prescribed for acid reflux, chronic heartburn, stomach ulcers, and gastroesophageal reflux disease, or GERD. For many people, they work extremely well. The burning discomfort disappears. Meals become enjoyable again. Life feels normal. The problem is that many people continue taking these medications not for weeks or months, but for years. Some remain on them for decades. Whenever they try to stop, their symptoms return, convincing them they need the medication permanently. What few people are told is that stomach acid serves a critical purpose beyond digestion. It helps your body absorb several essential nutrients, including vitamin B12, one of the most important vitamins for maintaining healthy nerve cells and normal brain function. When stomach acid stays suppressed for long periods, B12 absorption gradually declines. The same thing can happen with important minerals like magnesium and calcium. These nutrients play a vital role in helping brain cells communicate efficiently. Without enough of them, nerve signaling becomes less effective. The result can include mental fatigue, poor concentration, confusion, and increasing forgetfulness. In some individuals, these symptoms closely resemble the earliest stages of Alzheimer's disease, when the underlying problem may actually be a nutrient deficiency caused by long-term medication use. Research has raised additional concerns. A large study published in JAMA Neurology involving more than 73,000 adults aged 75 and older found that regular users of proton pump inhibitors had a 44% greater risk of developing dementia compared with non-users. Scientists have also found evidence suggesting these medications may increase levels of amyloid beta, the sticky protein closely associated with Alzheimer's disease. Although researchers continue studying this relationship, the findings deserve attention. If you take a proton pump inhibitor every day, it may be worth discussing with your doctor whether long-term treatment is still necessary. For some people, stepping down to a different class of acid-reducing medication, such as an H2 blocker like famotidine, Pepcid, may provide adequate symptom control while posing fewer concerns for cognitive health. Others may benefit from lifestyle changes that reduce reflux naturally, including avoiding late-night meals, maintaining a healthy weight, limiting trigger foods, and elevating the head of the bed during sleep. The goal isn't to eliminate medication that you truly need. It's to ensure you're taking the lowest effective dose for the shortest appropriate period. Because sometimes, protecting your stomach shouldn't come at the expense of protecting your brain. End of part 1.